The doctor you choose for your treatment of the spine may very well determine whether or not you get better or experience chronic pain. Hi, this is Dr. Gary Lee at Elevation Health. Good day to all my chiro friends out there. We're here to talk about some really good information today. I hope it'll be as good for you as it is for me. I've been treating patients with car accident injuries, chronic related pain, postural related pain, scoliosis, for quite a few years. I've been a chiropractor 26 years and focused on what is called chiropractic biophysics technique for the past 24 of those 26 years. So been at it for a while here. So this podcast, of course, is brought to you by Elevation Health here in Taylorsville, Utah. It's an advanced chiropractic clinic where our focus is on correcting abnormal postures, treating people who have been injured in car accidents, and scoliosis. So in today's episode, we're going to talk about some of the most advanced spinal treatment techniques on the planet. That is called chiropractic biophysics technique. So let's talk for a moment. Some of you are familiar with chiropractic, some are not. So I just want to talk about some of the great things that chiropractic can do. It's long been known that chiropractic is great to help reduce back pain, neck pain, headaches. There's still a lot of us that adjust knees and ankles and other joints in the body and work with rehabilitation in those areas. And so it's really been great for that stuff. But we also have to look at the fact that there is a difference between just treating back pain and joint pain and really getting to the basis of chiropractic. And so if you look at the historical perspective of chiropractic, it wasn't started because somebody said, hey, I've got some back pain. It was actually started because somebody said, I had hearing loss. And so the connection that was made many, many years ago, more than 100 years ago, by a man named D.D. Palmer was the fact that you could influence what was going on in the nervous system by adjusting the bones of the spine, okay, or the vertebra, because that is the protective covering. That is, it encases your spinal cord to protect it and allow for movement. So, the basis then for chiropractic is that we can affect the body's health, the neurology of the body, through adjusting the spine. And does that help get rid of back pain? Well, yes, it does. Does that help joints to improve in function? Yes, it does that as well. Can that help decrease neurological problems or communication between the brain and other parts of the body to help maintain health? Yes, it does. And so many, many people look at chiropractic and they say, yeah, those guys are a great back doctor. They're a great back pain doctor. But we need to expand that and realize that there's more to chiropractic than just back pain. So what new discoveries have been made in chiropractic? For the longest time, chiropractic, again, we adjust the spine, and people are somewhat familiar with that. But are there new advances? And I would absolutely say yes, there are. Just in other areas of medicine where research and studies are being published, there is plenty of new information about chiropractic. So chiropractic biophysics, if you're unfamiliar with that, is a treatment program that was begun by a doctor by the name of Don Harrison. Now, Don Harrison, in my book, he was a great guy. Just down to earth, easy to talk to, but he was also a genius. And I say that because of his credentials. He had a BS in mathematics, a master's in mathematics as well, MSc in mechanical engineering, a PhD in applied mathematics, and then he went on and also got his Doctor of Chiropractic degree. And later, through his research and application of mathematics and engineering to the spine, founded chiropractic biophysics technique and discovered a way that we could actually change the posture of the spine. So his son, Deed Harrison, later became also a doctor of chiropractic. Unfortunately, Don passed away a few years ago, and Deed has filled those shoes quite well, and is now in charge of running the chiropractic biophysics technique and chiropractic biophysics nonprofit, which is the research arm of chiropractic biophysics. So this year, and chiropractic biophysics has been around. Don't quote me on this. It's a little over 25 years. I think we're around 26, 27 years. So we're going to go down this path together. I'd like to start by talking about functional rehabilitation versus structural rehabilitation. Now, the term functional rehab has been around a long time. And so the definition for that is improving quality of motion, stretching, and active exercise that increases range of motion, strength, decreases pain, and increases activities of daily living. So you look at that definition, you say, well, that's probably a lot of the things that somebody needs if they're having problems. I feel stiff. I don't seem to move as well. The activities I used to do are more difficult for me right now. They may cause pain. I just don't seem to be as flexible. And so I start missing out on life. I start not being able to do the things that I used to do. And that's a shame. I mean, nobody should have to put off life due to the symptoms that they're going through. And if you are, it's well past time to address those things and find out why that is. But functional rehab for a long time has been the approach to try to get the pain to go away and get some movement. The problem being that a lot of people go through functional rehabilitation and still have problems, or the problems keep coming back. And so the range of motion never really gets back to where it should be, and the loss of function just seems to never quite go away. And that is a problem. So one thing that the Harrisons have done is really taken a look at structural rehabilitation. So let's define that. They define it as programs of exercise, stretching, and traction that change the posture and the spine towards a normal number, a normal measurement, right? Or a normal number of dimensional or 3D alignment. So you look at the body and you look at the spine, and they have done some great work in the three-dimensional area of what should the spine look like. And should there be a curvature when you're looking from the side, what we call the sagittal plane or the sagittal balance? What should it look like from the front on an x-ray? And are there normals, or does it matter? And it used to be years ago that the thought was, well, come on, you guys are chiropractors, but to be honest with you, we have all these kinds of changes in the alignment of the spine in the normal population. Some have pain, some don't have pain. Maybe it's just normal to have abnormal posture. But we know that that's not true, because the more research that's been published shows us that the abnormality in the posture causes a lot of problems. And so we're going to talk about that. So first and foremost is to understand the relationship between balance and symmetry, right? And a normal balance of the spine allows us to stand normally with minimal use of energy and expenditure of energy. And the more unbalanced we become, the more energy that is required. So let's take two quick examples. Let's just say you've got a bowling ball and I put it in your hand and I say, just balance it over your shoulder. Just hold it there. And you say, well, bowling ball, 10 pounds, man, I could do that all day. That's not a problem. All right? Well, now put it out here and hold it. And you change that balance and you push that weight further away from the body. Now it requires a lot more muscle action, a lot more force to resist gravity and to hold that 10-pound bowling ball up. And then I'm going to ask you, how long could you do that? Well, maybe you work out and you got a lot of muscle, but there's going to come a point where your muscles are going to start to fatigue. And you're going to say, Dr. Lee, I'm getting a little tired here. I'd like to put this down. And if I say, no, you can't do that, you must hold it, then you're going to start feeling that burning pain, right? Lactic acid buildup, those muscles are working. Pretty soon they're going to start to fatigue and you're going to start to shake. And you say, Dr. Lee, I can't do this much longer. I'm going to say, no, you must hold it up. And so then the brain kicks in. It's going to say, well, if I must hold this, I've got to start creating some muscle spasm. There are some other changes that are going to happen if I must hold this ball up. Now, at some point, you're not going to be able to do it. Either the pain will ever overcome your ability to hold that out, or the simple fatigue and weakness in the system, in the musculature, is going to be overcome, and your arm will drop, and the bowling ball will fall, and that's it. It's over. What about, and this is a big one, you see lots of moms out there that like to carry babies on a hip. And it's always the same one, because if they're right-handed, baby's on the left hip, and they walk around the house doing their housework and doing things all day long with that baby on there. Now, what does someone look like when they hold a baby on the hip? Are they sitting? Are they standing straight up and down? No, because baby, there's some weight there. And if you look at them, they're over here. Baby's over here. But their body must lean to one side in order to carry that weight. Think of someone who carries weight on their shoulder. They put a big bag of 50 pounds of let's say, popcorn, right, up on the shoulder there, and you must lean. The posture has to change in order to perform the activity and balance so that you can move and continue what you're doing. So symmetry and balance are extremely important to the spine. And we have these normal curvatures that help us to function normally. But when symmetrical balance is lost, right, we get a lean, and maybe it's not because we're carrying something, or maybe it's because we've carried something so long on the same side that literally now our posture has shifted and changed, right? So we get a symmetrical imbalance. We lose the balance, right? And then the posture becomes abnormal, all right? And then we have these stresses and strains to the system. We can call it stress to the bone, to the discs, to the ligaments, to the muscles. We have stresses that have now changed, right? And they really cannot be overcome simply by the brain saying, let's try this. It's adapted. It's changed. You now have a permanent lean, a permanent curvature that shouldn't be there. And so degeneration ensues. Now, typically we look at degeneration in the spine with postural abnormalities, and we know that these changes occur because of a difference in weight distribution, okay? So let's say that we look at a disc and you've got this change in posture, and instead of the vertebra lining up normal as they should, we now have this lean, or maybe it extends back more than it should. And you change the weight distribution on that disc. The disc is going to begin to degenerate. It didn't grow to handle weight distribution at an angle. It grew to handle it in a specific way. And frankly, the bones did too. So when you change that, now the weight distribution is going to tell the bone, you can't support this the way you used to. You have to change. Well, the bone can't simply section out a piece of your vertebra and regrow it to handle the new weight distribution. All it can really do is begin to deposit new bone on top of the old bone. We call that bone deposition or bone spurring, right? And we start to see a loss in the height of the discs. Now, any joint can go through a degenerative process due to abnormal weight distribution or abnormal alignment of the joint. So we look at that path and we say asymmetry leads to that imbalance that leads to changes in weight distribution and function that eventually we cannot overcome and leads to degenerative change. So functional rehabilitation really totally ignores posture and spinal alignment. It's after getting function through exercise and stretching, and hopefully that helps to overcome the pain and the stresses that are involved. Problem being, when that spinal posture is abnormal enough, you can't overcome it anymore, and you're getting beat in the game, right? Your body cannot respond fast enough in order to regenerate and keep you healthy, and it's losing that battle, and that's degeneration. According to research, the body or the brain will always try to create changes in our posture according to what has to be done to maintain what's called a forward gaze. Eyes want to be level with the horizon. You don't want to be doing this. You don't want to be doing this. They want to be level. So if I have a postural change that leans, my head's going to correct back up, and now I've got this postural abnormality. Eyes want to be level with the horizon. So they go on to talk about the fact that if there is any abnormal alignment, that there is a need to actually take what's called full spine x-rays, all right? In this particular study, they called a 3-foot standing radiograph that provides visualization all the way, the entire spine, top of the spine, bottom of the spine, pelvis, okay? That's called a full spine x-ray. So that is why when we changed to digital x-ray here in the clinic, we waited a little bit, and we found a company that produces a full spine digital sensor, 71-inch sensor, that we're able to take full spine x-rays. Now, that is standard of care when you're dealing with postural abnormalities. It is also standard of care when you're treating scoliosis throughout the world. And so we felt that it was worth the extra money and effort to have that ability, because that is our area of expertise. That's our specialty, is correcting abnormal posture and treating scoliosis. So we felt that that was an important step. Now, there are a number of articles that now state that is the way to go if you suspect any changes in posture. So we do it. Once those x-rays are taken, then we have to look at the measurements, and there are some very specific measurements that need to be done on x-rays every time. X-rays are not to hold up to a light and look and say, well, no tumor, no fracture, let's get to work. They're for a full and complete evaluation. Angles are important. Measurements are important. The neurosurgeons are doing them. The orthopedic surgeons are doing them. And the chiropractic biophysics doctors are doing them because it's an important step in understanding your condition, but also understanding what treatment needs to be applied to get the posture to change, improve, and allow for normal function again. So while deformity of the cervical spine occurs in both the sagittal and coronal planes, sagittal being looking from the side, coronal being looking from the front, sagittal plane deformities not only arise more frequently, but when surgically corrected appear to play a more critical role in achieving better clinical outcomes. So in a lot of the research, and certainly in a chiropractic biophysics clinic, you're going to hear the term sagittal alignment frequently. That's the alignment looking at it from the side. What are the curvatures like? How far forward has the head pushed? Is the thoracic cage too far back? How is the angle of the pelvis? Those things are determining factors for understanding your problem, your condition, and also understanding the type of treatment that is going to be required to improve it. Now, I'll tell you right now, and some may argue, but don't argue with me. In God we trust, all others bring research, all right? I didn't coin that term, but I'm a believer of it. So chiropractic, general chiropractic, does not change posture. And if you want to take that up with me, bring your research. Let's talk about it. If you show me an article that says an adjustment corrects posture, great. I'll be accepting of looking at that. Currently, we've got 300 articles that talk about changing abnormal posture, and the way to do that is through utilizing the technique of chiropractic biophysics. So, bring your research, but don't come to me with incidental stories or anecdotal stories. Well, I had a patient once, and, I think that's great, and we can see some occasional things, but to prove something, to show that it has some validity, it needs to be repeatable. You need to be able to look at it and say, we did this with 20 patients. We've done this with 50 patients. We've done this with 300 patients, and here are the results. And it shows that it's valid and that it actually works. So now this talked about surgical outcomes. Improving surgical outcomes in these sagittal problems requires measuring. It requires x-rays. It requires understanding the angles, because surgeons found out a long time ago, if they fuse your spine at the wrong angle to try to correct myelopathy or other neurological problems, what they've done is caused more problems, because the ensuing degenerative change will cause more problems at the next segment above or below. And then you have another surgical procedure to go through, and then another and another. And the standard used to be about every 2 years, you're going to have another one. So I'm not saying anything bad about surgeons. I think they've done great work in doing postural research and understanding how to avoid that problem. And avoiding the problem is done by understanding the posture and the necessary change that needs to be made in correcting the sagittal balance so that it's balanced and the posture is right. And surgically, that has made a world of difference in their outcomes. And so we look at chiropractic and say, what can we do? Well, if you're a chiropractic biophysics doctor, you can improve and change posture, just like they do surgically, but we don't use surgery to do it. So the three things we use is a chiropractic adjustment. We need to talk about that. Exercise and traction. So it's been shown that a standard chiropractic adjustment has a net effect, a net change of 0 towards correcting a postural abnormality. Okay, it's because of the way the adjustment is done. So chiropractic biophysics researchers have developed 3 things that give us the tools necessary to change the posture. The first one is what's called a mirror image adjustment. So we put the body or the spine in an opposite posture of what we see on the x-ray, and then we apply the adjustive force in that direction. And that starts to create change in the posture. Second, exercise. Now, we're not talking about general exercise. My patients don't come around and jog around the clinic and do push-ups and sit-ups. You can do that at the gym. General exercise does not change posture. It helps stabilize your core. It will help strengthen muscles and help with function. But again, that's functional rehab. We need structural rehab. So they have come up with what's called mirror image exercise. Mirror image exercise is to force the body into the opposite posture of what we see on the x-rays and exercise the tissues in that direction to help them to change. Now, not only does that help to strengthen some of the weaker tissues, but it also helps to hydrate the tissues, get the blood flowing, right, into the joints and into the tissues that need to change so that when we do traction, we get a better outcome. So exercise is always performed prior to doing traction. Guess what we call the traction? Yep. You're right. Mirror image traction. I should have done a multiple choice test on that, but I knew you'd guess it anyway. So mirror image traction is to place your body in the opposite posture and then apply traction forces that have been shown to help correct stretched ligaments, correct the postural abnormality, so it begins to adapt to a normal position. Now that is structural rehabilitation. Mirror image adjusting, mirror image exercise, followed by mirror image traction. Now, it is a little more complicated than just saying that. There are approximately 17 different postures that the low back can assume. There are about 7 to 8 different postures that the neck can assume. Therefore, there are 8 different tractions and 17 different tractions for the low back, 8 in the neck, that must be performed correctly. If I apply the incorrect traction, we're not going to get results. So an understanding of the measurements on the x-ray, identifying the posture that you have, and then applying the correct treatment, the appropriate treatment protocol, is what gets us change in posture. So it's extremely important to identify first correctly and then apply the appropriate treatment. Because if you don't, the outcomes are going to be poor. Patients aren't going to get better. Chronic pain will ensue. Degeneration will ensue. And that's why I opened this video or this podcast was saying that the doctor you choose to treat your spinal condition may be the major determining factor in whether or not you get better or you go on to chronic pain. So you can't just say, well, I saw a chiropractor. Did it work? Well, I don't know. Yeah, no, it didn't. Or yeah, it helped, but later my symptoms came back. All chiropractors are not created equally. All doctors are not created equally. And so an understanding of what's going on and what may need to be done by the patient is extremely important so that you understand what the doctor may be looking at and may need to do for your treatment, okay? It's no longer a matter of saying, well, I don't know anything, I'll just do what the doctor tells me to do. I think in today's world, we have so much, I mean, this is the information era. We have so much information available to us that you can research and understand a little bit of your condition before you go. So what I've laid out for you today is a good understanding of what you should be able to understand or know going in to see a doctor. And when they say, oh my goodness, look, you've got a loss of curvature in the neck. Well, doctor, what do you suggest we do? And he says, well, we're going to adjust you a few times. We'll put some hot packs on and maybe some stretches, and let's see. That is not structural rehabilitation. That is functional rehabilitation. Functional rehab does not change posture. That means that you will not get the changes that you need. You will not have the normal function you need. The symptoms will return. The stresses will overcome your body's ability to respond, and you will degenerate. Do you see where the path leads you? So I'm hoping that you come away with this with an understanding, a greater understanding, or at least a desire to understand what's going on with posture. It's not about just looking good and sitting up straight. You'll look better. I promise you're going to look better because your posture will be good, okay? But it also has better function. Those aches and pains that may have been around for years, the chronic pain that you deal with, and maybe that started with a fall, maybe that started with an accident, whatever changed that posture has led to an abnormal function. Let's fix it. Let's correct it. That's why we call it corrective care. Chiropractic biophysics is corrective care because the desire and the goal from day one is to correct the abnormality that causes the problems. So That's what advanced chiropractic treatment is: structural rehabilitation of the spine. Now, research shows that CBP is uniquely positioned to treat chronic pain, car accident injuries, and other conditions that involve postural changes in your spine that lead to biomechanical changes. Okay? Postural abnormalities lead to degeneration of the discs and the bone. It leads to arthritic change in the spine. Why wait until the change is there? Why not fix it now and avoid the problems of arthritic change? Okay, so although we focused on a lot on the studies that deal with the neck today, the same applies to the upper or the lower back. It doesn't matter. Postural abnormalities can be corrected. It doesn't matter where in the spine they are. They can be corrected, and that will help the function to be restored. So just want to say thanks for joining. Sorry if I'm getting a little too serious here. It's what I do, but I eat, sleep, dream, and think posture day in and day out, because that's where I'm at. So thanks for joining us. I hope you take away from this some good information. If you have any issues that come up, if any of this rings true, then give us a call here at Elevation Health, 801-974-5555, and let's talk about what's going on. Let's see what we can do to help. All right. In the next episode, we'll be talking about the spinal deformity called scoliosis and how it can be successfully managed non-surgically. So Dr. Gary Lee here at Elevation Health, chiropractic physician and founder here in Taylorsville, Utah. We'll see you at the next episode.